Health Beat, brought to you by Shannon Medical Center and Shannon Clinic.
Genetics, smoking, and external stimuli are the three factors that may contribute to developing macular degeneration.
Well, macular degeneration is a condition that affects the retina, usually in patients from 50 to 80, 90 years of age. It tends to be characterized by an accumulation of a substance in the macula, which is the center part of the vision, and this tends to gradually damage the photoreceptors in the retina, causing significant visual loss over time.
There are vitamins and medications to help prevent the progression of this disease. However, for smokers, simply the act of quitting can reduce the patient's risk.
We do have different types of macular degeneration. We have the dry type, which is the most common one. It's the one that affects about 80% of the population that has macular degeneration. But about 20% of the patients with macular degeneration actually can have the wet type macular degeneration, which is abnormal blood vessels growing underneath the retina and kind of like leaking either blood or fluid underneath the retina. And for these patients, even though they only account for about 20% of the patients that have macular degeneration, they actually are 80% of the patients that have significant visual loss from macular degeneration. So for these patients, there's other treatment that is usually offered by a retina specialist specifically.
If you happen to have a family history of macular degeneration or experience unusual blood or fluid within your eye, make sure to be seen by a healthcare professional as soon as possible. To make an appointment with a Shannon ophthalmologist, call 481-2286.